Welcome, my name is Peter Strong. I'm a professional online therapist teaching mindfulness therapy for the treatment of anxiety and depression. If you're interested in therapy over Skype for treating anxiety and depression, then do please go to my website and learn more about this online therapy service, and particularly the mindfulness therapy approach that I teach online. It's very effective, and most people that I work with really prefer online therapy to meeting in person with a therapist. It's more convenient, and it's also much more empowering for you. You feel more in charge when you're conducting your therapy session from home. There's no difference in the quality of therapy or psychotherapy online, as long as you use Skype or a similar video format so that you can see each other. If you can see each other on Skype, there is no difference to meeting in person. And indeed, from my experience, people prefer online therapy via Skype. They also find it to be much more appropriate for dealing with anxiety disorders or difficult emotions, where it's often very difficult to talk about those emotions in person. The interface of the video format usually makes people feel much more comfortable about talking about difficult emotions, and that's very important. So from my experience working both online and in person, I prefer Skype, and I offer my sessions almost exclusively now via Skype. This is not a medical approach. I do not diagnose illnesses, and I do not treat illnesses. And in fact, I don't recommend that sort of treatment-based approach. Medications, more often than not, cause more problems than they solve. They certainly do nothing at all to heal the underlying psychological process that causes your anxiety or depression or other form of emotional suffering. So emotional suffering is produced by the mind, and it needs a psychological approach to uncover the mechanism that produces your emotional suffering. Treating it with medications is not going to do that. Trying to escape your emotional pain through addiction is not going to help either. And also endlessly talking about your emotions is not really as good as working with them directly. And that is what I focus on in mindfulness therapy. We don't talk about our emotions or our family history so much. That's of secondary importance. The primary importance is, how do you generate your anxiety or depression? What happens in your mind that creates those emotional states? We start to take charge of this process. We uncover the underlying blind reactive habits and reactive habitual thinking and reactive beliefs that support your anxiety or depression. We also look at the structure of the emotion itself. This is very important. What exactly is anxiety or excuse me, or depression? What does it look like? What is the underlying imagery that generates that anxiety or depression? The area of working with imagery is one of my specialties, and it's a really interesting area. Not many people study this or teach it online. but it is quite clear to me that all emotions are based around internal psychological imagery. How you see the emotion in the mind is what actually creates that emotion. That's the primary cause, the imagery. And that imagery becomes habitual. So basically what happens is whenever the right conditions are present, whenever the right triggers are present, those triggers trigger that internal imagery, and that creates the emotion. So uncovering this imagery is very important. You can explore this yourself. Just simply focus on your emotion and try to get a sense of the imagery. Ask yourself some simple questions. For example, where do I see this emotion? It's very often seen in the body. It has a physical position, maybe in the chest or the throat or the stomach or in the head. But it has a position. That's part of its imagery. Typically, people feel overwhelmed by their emotions. Well, that tells you that the imagery is very large. It also tells you that it is in a high position in your internal psychological field of view. It has to be in that position in order to be overwhelming. So this is quite interesting because we can make a statement here that a depression cannot be overwhelming if it is made very small and if it is placed at a lower level on the ground, for example. It has to be in that particular configuration to work. Well, as we uncover the imagery of our emotions, we can start to change that imagery. The imagery is simply habitual. There's nothing special about it. It's just got established out of blind habit. So we uncover this imagery, which is quite easy to do, and I will teach you how to do this. And then we work on helping that imagery change. And the golden rule here is when the imagery changes, then the emotion changes. And so this is the primary mechanism for the healing of emotional suffering. That is, changing the imagery. Reactive thinking and reactive beliefs have the effect of feeding that emotion and its imagery. But it's important to understand the difference here. Rumination, thoughts, reactive thoughts do not cause emotional suffering, but they will feed it. So it's very important that we uncover those blind patterns of reactive thinking that we simply follow without any choice or any control at all. We need to see those thoughts and beliefs very clearly, and we need to break the habitual nature of those thoughts and beliefs. And we do this by developing mindfulness. Mindfulness is a very special form of consciousness that allows you to see things clearly as they are, to stay as the observer. And that's the important thing here. If you can remain as the observer and not fall into the patterns of reactivity, then you are basically training the mind to free itself from those habits. So developing this observer consciousness is the hallmark of mindfulness, and it is the hallmark of the healing properties of mindfulness. The more that we start to develop objectivity in relationship to our emotions and thoughts, seeing them as objects in the mind and not identifying with them, the more that we can help them heal. And this is the active side of mindfulness work that we call compassion, the response of compassion. Compassion means being able to be present with suffering and then helping that suffering heal. So we're able to be with our emotions because we are not reacting to them, and now we can start to help them heal even further, often mostly by the process of helping that imagery change, but also just by developing that different relationship that doesn't feed the emotion, and a different relationship internally in which you provide the emotional strength and fearlessness and love for those parts of yourself that are in pain. This internal connection is a very, very important feature of mental health. You need to learn how to develop this internal relationship between your higher self and the emotions and content of the mind. So there's lots to explore in this very rich teaching on mindfulness. It's a wonderful topic to explore and develop, and I will teach you how to apply mindfulness online during our Skype therapy sessions. Mindfulness therapy works very well over Skype. It's excellent, and it's one of the most effective approaches that I know of for healing anxiety and depression, for treating them without using medications or other means of suppressing those emotions. So if you'd like to learn more and you like the idea of therapy over Skype, then please go to my website and please feel free to send me an email. Ask any questions you may have. Tell me more about your particular situation, and I will be happy to explain to you how I think we can help you overcome your emotional suffering using the methods of mindfulness therapy. This system has proven very effective. I developed this system of mindfulness therapy, or mindfulness meditation therapy, as it's also called, many years ago now, and it still really is the best approach that I know of. It has some elements of CBT or cognitive therapy in it, but it really works much more at the fundamental level of emotions, since we understand that thoughts do not cause emotions. It's the other way around. Emotions lead to reactive thinking that then feeds the emotions. So working with the emotions is the most critical thing that we can do here if you want to produce effective and lasting healing. If you really want to overcome anxiety or depression or OCD, or if you really want to recover from emotional trauma, then mindfulness therapy is the best choice. So please contact me if you would like to schedule some therapy sessions over Skype, and I'd be happy to work with you. Thank you.